Mediastinal mass is a gray area for many students, literally. However, I want to make a simple way for you to localize a mediastinal mass on a chest X-ray and be able to narrow down the diagnosis. We will use a flowchart to simplify the steps, because let's face it, who doesn't love a good flowchart? So let's say we have this large mediastinal tumor. The first thing we're going to look at is the hilum overlay sign. The hilum overlay sign describes a useful sign on a frontal projection that can help us decide if the consolidation is adjacent to the hilar vessels or not. You probably heard of the silhouette sign, and this is kind of the principle behind the sign. The principle being that the only way to differentiate two structures on a chest X-ray is if they are of different densities. So let's say two structures are next to one another with similar density, there's no way we can tell them apart, because together they will just form one big consolidation. So here, if we look carefully, we can still see the hilar vessels. This means that the tumor and the hilar vessels, they cannot be next to one another. Otherwise, we shouldn't be able to tell them apart. This is a positive hilum overlay sign. This means that the tumor therefore must be either in front of the pulmonary vessels, anterior, or behind them, posterior. Statistically, the tumor is more likely to be in the anterior mediastinum, but we want to do a bit better than that. So we'll have a look at the lateral X-ray and we locate the retrosternal airspace. This airspace should only contain air, and if our consolidation is seen here, we know it's an anterior mediastinal mass. Differentials here will include the 4 T's, the classic ones: thymoma, thyroid goiter, teratoma, and terrible lymphoma. If our patient is over 40 years, thymoma is the most common differential. If our patient is a female between 10 and 39 years old, it's most likely lymphoma. However, if our patient is a male between 10 to 39 or child under the 10 years of age, there is no differential more likely than another. A CT was performed and confirmed our finding of an anterior mediastinal mass. This turned out to be lymphoma. If it would have been a posterior mediastinal mass, differential here would include neurogenic tumors, most commonly schwannoma for adults or ganglioneuroma for children and young adults. If, however, the hilum overlay sign was negative, which means that we cannot see the hilar vessels through the consolidation, we next check for the convergence sign. So to demonstrate, we'll have a look at this case. Here we have a mass or consolidation, and the hilum overlay sign, we can't really tell the vessels apart. So this consolidation must be either next to them, or it can actually be a trick, and this might actually be the pulmonary vessels themselves. The convergence sign can help us figure that out. With this sign, we look to see if the pulmonary vessels join together, that is, converge together towards this consolidation or not. If the vessels converge towards the consolidation, it means that the consolidation is simply an enlarged pulmonary artery, which we can see, for example, in pulmonary hypertension. Here we can see that all the pulmonary vessels seem to converge together at the lateral aspect of this consolidation. So this is a positive sign. However, if they do not converge, we know that this is a middle mediastinal tumor. Differentials for a middle mediastinal tumor will include lymphadenopathy, ascending aortic or aortic arch aneurysm, and bronchogenic cyst. Now, to summarize, if we have a mediastinal mass on a chest X-ray, we first look at the hilum overlay sign. If it's positive, we know that this is an anterior or posterior mediastinal mass. Next, we look at the retrosternal space. If it's occupied, we have an anterior mediastinal mass. Differentials here include the 4 T's: thymoma, thyroid goiter, teratoma, and terrible lymphoma. Differentials for a posterior mediastinal mass include neurogenic tumors, most commonly schwannoma for adults and ganglioneuroma for children and young adults. If the hilum overlay sign is negative, we look for the hilar convergence sign. If it's positive, we have an enlarged pulmonary artery. If it's negative, it's in the middle mediastinum, and differentials for middle mediastinal mass include lymphadenopathy, ascending aortic or aortic arch aneurysm, and bronchogenic cyst. I hope you found this video helpful, and if you did and you'd like to see more content in the future, don't forget to like and subscribe. Thank you and take care.